So I watched those first two videos, and it seems like I'm very monotonous and kind of lost. So I'm going to try something a little bit different, a little bit different approach. I'm not going to look at myself on the camera. I'm just going to kind of talk and try to be as natural as possible, so that I'm not as boring as I seem to be. So this next video is again a little bit about me, and a lot of this is going to be about me because it's my channel, and it's about my experience. So like I said before. Well, again, this video is going to be a little bit about me and my path and what it takes to get into a PA program and what's the schooling like and all that. So, okay, like I said, before I became a PA, I was a PTA, physical therapist assistant, and I really enjoyed doing that. But, you know, there was an incident where I was doing home health and I had a patient code on me, and I had to perform some rescue breathing, and that kind of shook me a little bit and made me try to want to do something more for my patients and expand my knowledge. And you know, I had some knowledge of the PA profession because I saw a PA at my primary care doctor's office, and so that's how I was introduced to it. And then also, being in the National Guard, I was in a combat arms unit, and all the combat arms units at that time had a PA organic to them that was slotted to be with them. What that means is that they had a position for a PA. For a number of years, we had a PA who was still in the National Guard and still a great PA, and I learned a lot from him. But at one point, he moved on, and we didn't have anybody. And so I was the closest thing we had at that time, and I kind of helped and did some different things with the medics, but it wasn't the same. So I started looking into different PA programs, and the Army has a program called IPAP, Inter-Service Physician Assistant Program, and that again allows for all of the military services to send a certain amount of individuals to the program or the school to become PAs. So as I investigated, I found a recruiter by the name of Sergeant First Class Ann Ermitinger, and maybe she became Master Sergeant. I apologize if I forgot about that part. She was very instrumental in helping me put together my application for IPAP and helping me get accepted. I did not get accepted my first time. The only reason was that they had more than enough qualified applicants. But I did get accepted my second time. So a little bit about getting into PA school. They look at the sciences significantly strong. So they look at your anatomy and physiology, okay? And my take on that is, and I learned this from the physician that taught me surgery in PA school, was that if you know proper anatomy and physiology, meaning if you know how the body's supposed to work, then you can figure out when something's wrong and then go down the pathway to figure out what exactly is wrong. Okay? So knowing the right way will help you figure out the wrong way. So, and that's always stuck with me. So they look at anatomy and physiology. They look at chemistry because the pharmacology class is very difficult. They look at some physics and things of that nature. They look at your chemistries. I already said chemistry, right? And so they were really, as far as grades go, there was no, you had to have, I believe, and I may be wrong, but you had to have at least a 3.0 cumulative or 3.0 GPA for all the prereqs for the program. And the prereqs are various, and it depends on what program you're applying to. But that being said, most students that were accepted had above a 3.5. Okay, but that doesn't mean if you have a 3.2 that you're not going to get accepted, because your grades were not the only thing that they looked at. They also, in my program, they looked at a lot of military aspects as well. They looked at your physical fitness, your past experience in the military, your past ratings and scores, and all that kind of stuff. They also You also had an interview, and there was an interview process, and they had to make some or form some opinions of you with the interview process. I don't know if they're still doing that or not, especially with COVID. Maybe they're doing Zoom interviews. So, um, that being said, not every person who is smart enough to be a PA is made to be a PA, and that means that you have to have a certain amount of empathy and sympathy and people skills and interpersonal skills to be a good healthcare provider. Even if you're the smartest guy on the block, if you don't have those skills to relate to people, people are not going to want to come and talk to you and be honest with you and see you, and that's part of being a healthcare provider. And I would say that goes for physicians, physical therapists, and anybody in a medical profession. So, all right. So let's talk about PA school. At the time that I went to PA school, it was a 2-year program. We did 1 year. I'm not even going to say where, but 1 year at a military base, which was the didactic year, right, where we sat in class and learned, and it was an ungodly amount of hours that we spent there. It was akin to taking, I want to say, 18 hours of college credit plus for 3 trimesters. Okay. I'm a pretty smart guy, but I'm not the smartest guy. And I had to study, and that's just the way that I am, and that my brain works. I spent just about every day and night studying. When I went to school away from my home, I did not take my family with me, although I did have the option to take my family with me. I chose not to because I knew that if I did, then something would have to give, and I would either have to neglect my family or my studies, and I was doing this essentially not just for me, but for my family. So I didn't want to take my wife and kids away from their family and their help, for me to go to school and not be there for them. So I chose to go there and live in a little apartment and do my schooling like that, without my family being there. Although they've always supported me in all of this. I have a great family. So like I said, literally I studied every day except Friday evenings when I went to the movies to give myself a break, or my brain a break. I mean, literally I would have dreams about medical scenarios and medicines and this, and it was ridiculous. But I put a lot of time and effort into the didactic portion of this. Some people don't need to do that. Some people can. I had some friends in class that, they did a little studying here and there, but they lived life and, went about their normal life and did really well, So out of 50 or so, I think we started with 50 and we wound up graduating maybe 45. We probably lost 5 people due to academics in the whole 3 trimesters. I may be wrong, but I want to say I finished 7th. It's my daughter. She's actually calling my wife. So I finished 7th in the class, I believe. Somewhere in there. Not between 7 and 10. I can't remember. 2004. Who can remember that far back, right? A lot's happened since then. So a lot of studying. Phase 2 of the program is our clinical rotations. And there's a certain amount, say, at the time we did 5 weeks in orthopedics, which happened to be my first rotation. We did a certain amount of time in family practice, dermatology, and so you kind of get some experience, clinical experience, in all of the different, or almost all of the different specialties of medicine. So even ophthalmology, we spent a couple of weeks. I mean, if I had to sit down in front of a slit lamp and do an exam, Today, wouldn't know what the hell I was looking at. But at the time, we learned how to do all that. As a physician assistant, you can work in any specialty that you want to. Um, you do not have to specialize. If you decide that you want to leave orthopedics and go in family practice or emergency medicine, you can do that at any time without any additional training. Um, that being said, if you are choosing to change specialties, then you should definitely make sure that you know what you're doing and brush up on certain things and take some refresher courses and such. But the opportunity to practice in any field of medicine is always there throughout your career. So to become a PA, you need to finish the at least 2-year program. It's longer now because they're all master's programs, and some of them are even going to be doctorate programs that are out there right now. Once you finish through an approved school, then you have to sit for your boards or certification, and that's run through the NCCPA. Okay, and the test, I believe, is called the PANCE, P-A-N-C-E. Okay. Physician assistant, blah, 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 blah. I don't know the name of the acronym, and I don't really care at this point. But you can find it on the NCCPA website. And actually, I think I have that linked through the YouTube channel here. So you have to sit for the PANCE, which is 4, 5, 6 hour test at a testing center. Costs about $500 probably these days. And you have to pass that test at a certain level to get your national certification. Once you have your national certification, you can get your state license. In between then, you can practice with the intent that you're going to take the test and pass it. Okay? So you can practice temporarily until you get your NCCPA certification. Okay? So you get your NCCPA certification, then you get your state license, and the credentialing process is a beast. Okay, everything takes time, although it is a little bit easier these days with online applications. In order to prescribe medications in Louisiana, you have to have a CDS license for Louisiana from the Pharmacy Board. Okay, in order to prescribe controlled substances, you have to have a DEA license. And that's another process, and so there's a lot of that involved. So, going back a little bit to school, we were taught by physicians and other physician assistants in what they call the medical model. So the model was based off of how they teach medical school, but in a more accelerated fashion, without as much theory in medicine as you would get in medical school. So I get this question a lot, or I used to, not as much anymore, but what's the difference between a PA and a nurse practitioner? Well, nurse practitioners are taught under the nursing model. And the way I was taught, okay, the way that it was explained to me by several physicians that were professors in my program, the nursing model is based off of algorithms. And it's basically more of a treating the symptoms as opposed to the investigative process of finding a diagnosis and treating the source. I didn't make that up myself. There was a doctor, a physician, surgeon that specifically explained it like that. Also, recently there was a investigative reporter locally here in Louisiana, in New Orleans, that did a report about nurse practitioners and the fact that they don't have any type of central licensing body, right? They have the nursing board get your license and the state nursing board, but as far as nurse practitioner schools go, there is no certifying body that makes sure that the nurse practitioner program at each individual school is appropriately and adequately administered. For instance, there was some students in the nurse practitioner program that stated that they had to watch a movie, some ridiculous movie, as part of their class, and it counted for 50% of their grade in this class. Some nonsense like that. And I think that hurts the nursing profession, nurse practitioner profession, a little bit. However, there are many, many more nurse practitioners in my area than there are PAs. Okay, and the nursing political action committee is extremely strong and has a lot of power through the legislature. So, okay, let's see. Anything else? What am I missing? Oh, so briefly, once I graduated PA school in September of 2004, I had got a job with an orthopedic and spine surgery group. I started working with them from October 2004. I was notified in February 2005, which is only 4 months after I started working, that I would be deploying with a unit from the Louisiana National Guard to Iraq. And I deployed for Iraq in March of 2005 and did a lot of on-the-job learning in Iraq. So, also, one last thing. The rules of PA supervision differ by state. And it used to be in Louisiana that a physician could supervise 2 PAs or MPs or a combination. I think it has now moved up to 5. So, which is similar to anesthesiologists and CRNAs, as far as that ratio goes. So there are definitely some things that are changing when it comes to supervision of physician assistants by doctors, especially with COVID going on. But that's going to be a long discussion of the future of our profession. So too much to talk about here. So in a subsequent video, I will talk about that. So okay. Real quick, let's see here. Hold on a second. Yeah, give me something. My son's going to Starbucks. All right. Give me a caramel frap. Caramel frap, no whip. Okay. So wait a second. I'm looking for the email from. All right, this is the email from Anika. Can you tell us about your undergraduate journey and what led you to become a PA? Okay, I think I hit on that. What type of extracurricular activity did I participate in? Well, I worked as a PTA before I went to PA school and all that. So extracurricular activities that I do, I worked out regularly, especially being in the military and on active duty while I was in PA school. All right, and I think I hit on most of these questions. So, well, some of them I can talk about a little bit later. So, all right. So let's see. Let's where are we at? Okay. So that's the end of this video.